𝗃𝗧. All right, now when it comes to lung volumes, there are two skills that need to be mastered, especially for the NBRC exam. The first is related to creating a formula to calculate a specific lung volume that they request. And the second is very close to that, but it's related to using numbers on the PFT chart to calculate one of the volumes. As you might imagine, you kind of have to understand what are the possible formulas. In other words, what could you add together or take away to get the volume that they're requesting. So let me just show you what we mean by creating a formula first to calculate a volume that they're asking for. And in the presence of being given only some of the volumes on the PFT chart, but not all of them. It's really just kind of a puzzle, and it's pretty easy when you practice it just a bit, but it is a little bit daunting at first, so let's take a closer look. So, for instance, let's just say the exam asks you to create a formula to calculate inspiratory capacity. Now, looking at the chart here, you can see that inspiratory capacity in its most basic form, also called 𝗖𝐶, is really just made up of the IRV, the inspiratory reserve volume, and the VT, or the tidal volume. And so, thus, in its most simplistic form, I could just write an accurate formula that looks like this. 𝗖𝐶 is equal to IRV plus VT. That's very logical. It's easy enough, isn't it? So let's just take a look at another volume. Let's take a look at 𝑉𝐶. So what's the formula is going to be the question. Well, there's more than just one formula that would work. So first we could say at its most basic form that vital capacity is equal to IRV plus VT plus ERV. And we see that that works because the distance from top to bottom that it takes perfectly matches that of the VC. But take a look at this. We could also say that VC is equal to 𝗖𝐶 plus ERV. So rather than break apart 𝗖𝐶 and talk about it as IRV and VT, we could just use the combination volume that we've talked about before and just use that in the formula as well. So you can see there's a few different ways to approach that. And that's not all. Just to give you an idea of what we're doing here, I like to look at the volumes on the PFT chart as if they're separate tiles that we can almost move around, and what we're trying to do is cover up perfectly the volume that they request. So let's just say with VC, first we slide over the 𝗖𝐶 tile to cover up some of the VC, and we see that it covers up part of that, so that's a good part of the formula, but you can also see that we need a little bit more. How much more? Well, we need this much more. And to find out the other volume that we need to use for that, we simply move straight sideways until we find the tile that looks like that volume. And then we move it over. Notice that I can't look diagonally for another volume. Even if it looks like it's about the right size, that's not what we're doing. We have to go straight sideways. I can only look sideways and then move it over perfectly sideways until it covers up the rest of that volume perfectly. So let's just do let's just focus on the VC again, but I want to approach it from a different point of view. I could start a calculation that said VC is equal to TLC. Now let's go ahead and slide that over the VC, and right away we have a problem. The TLC covers the VC, but actually it over covers it, doesn't it? It overlaps it by how much? Well, it overlaps it by this much, and that's an amount that I would like to be able to cut off, or in this case, mathematically, to take away. So now I'm going to look for the volume that cuts that amount off perfectly. Remember, my rule is I can only look straight sideways from that overhang, and I find the volume that looks like that. And presto, what do I find when I go sideways? I find the RV. And so the formula looks like this. VC is equal to TLC minus the RV. And so you get the idea. We're going to do more of these, but that's how it basically works.